It's a bit of a weird story. I am a trained medical doctor, whereas if I was a medical doctor, until the day I die, that's a guaranteed, a job, right? You don't have to worry about anything. I could easily specialize and really excelled in that field. But I thought, doesn't matter how great of a doctor I am, my impact's just still local, right? I can treat 1,000 patients, so what? But with generative AI, you can make change at a global level. Like no vacations, none of that stuff. Rarely, I think last month I took the first vacation in a very long time. Like, because it's interesting for me, right? It's fun. I don't necessarily think, oh, damn, I need to do this today, but I say, oh, damn, I get to do this today.
So that mentality of like, we don't have anything.
That's the only thing holding people back, I would say. I mean, if you have 2 hands, a laptop, I mean, it's not fair. Yes, some person might have more than you, but it is what it is. You can complain or you can, live with the hands that the cards that you're dealt. Do it now. It's never been easier to learn. I honestly wish I was in university when Claude and ChatGPT came out.
Thank you for being on the podcast, Sitra. So let's go ahead and start. What do you do and how do you explain it to somebody who doesn't know any idea about this field?
So what I do, all right. So I think who I am and what I do, it's a bit of a weird story.
Yeah.
I am a trained medical doctor. I was practicing medicine
Wow.
in Sri Lanka, and I've always been passionate about technology. And after my internship, I got an opportunity to work part-time in a health tech startup remotely,
Wow.
and that turned into a full-time gig. So I started off in a product, then
Mhm.
went up to operations, and then I became sort of self-taught in generative AI and ended up leading the team at that startup called HeHealth.
Wow.
After that, I was a generative AI lead at another place,
Mhm.
and now I currently lead the team at my current startup,
Okay.
where we build AI agents.
For any purpose or?
AI agents, particularly for back office operations, the sales, finance,
Wow. So
operations.
completely different.
Completely different. I still I still work. I have my foot in the health tech startup as well, but my full focus for the past year has been designing these agents and building the team up, leading the team.
Wow, that's really cool. Was it hard for you to like adapt?
Um, yes and no. No, but I know the skill sets that I developed as a medical doctor applies directly to my work right now, right? Problem solving is one thing, right?
Right.
Time management,
Mm.
managing 100 different things that pop up and trying to, reorient them based on their priorities.
Right.
And that's what a startup is, right? There's 100 different balls
That's
in
true.
there,
Yeah.
and then you have to prioritize what you do today. Same
Wow.
thing I did in a medical ward, right?
Very cool.
So I sort of translated that into what I'm doing right now.
So, was there any inspiration between you kind of making this change, or was it something else?
Yes. So before I started my clinical journey, uh, I was working in a private hospitals in a non-clinical capacity because I did my
Oh,
degree abroad. So when you come
gotcha.
back to Sri Lanka, you have to do exam, and at
Yeah.
that point there were strikes. So there was a few years where I couldn't do the exam.
Right.
So I started off doing audits, clinical audits, and that's when I sort of got into data, right? So I dipped my toes by doing data analytics. Then I started building systems. I like building things.
Hmm.
And even when I went for my internship, I still missed that. So when I got that opportunity to get back into health tech again, I took that chance without really thinking again. And this too was a massive risk for me because when I checked out the startup, I knew they had about 5 months of funding left. Whereas if I was a medical doctor,
Right.
until the day I die, that's a guaranteed, a job, right?
Right.
You don't have to worry about anything. I could easily specialize
Yeah.
and really excelled in that field. But I thought, it doesn't matter how great of a doctor I am, my impact's just still local, right? I can treat 1,000 patients, so what? But with generative AI, you can make change at a global level.
Right.
So it's a very hard conversation to have with people that know you, especially family friends. And I hope Sputa, like, what are you doing right now? I'm in AI. Like, what? But you're a doctor. Like, my mother also. It took a while for her to sort of wrap her head around that concept.
So, what problems are you trying to solve now, and why does it matter to you?
At my current startup, I mean, right now, pretty much if you go to any office, right, a lot of people are just doing a lot of boring, mundane work, right?
Yeah.
And that's soul crushing.
Yes.
Looking at the same Excel sheet, looking at Word documents, and we believe that's not necessarily where humans excel at or what humans were meant to do. And that's why AI agents come in, where they can do the repetitive, mundane, boring stuff, so that you can do the human things, right? Be creative, problem solve, be more than just
Mm.
a automaton of sorts.
Wow.
And the same thing applies to healthcare as well. Like as a doctor, we just do so much manual,
Yes.
paperwork, and that takes time away from actually treating. We don't become doctors to fill out papers per se.
Right.
We become doctors to treat.
Right.
And that's a similar theme across everything that I do, right?
Mm.
To make a change by automating certain things.
That's actually a very interesting way of putting it. I don't think I've heard that point of view. So that's really refreshing to hear. What challenges have you faced so far, and what have you learned from them?
So again, I came from a completely non-technical background into a technical background, right? So there's a bit of imposter syndrome there as well. So I always
Yes.
try to benchmark myself against like others. So we join
Mm.
hackathons to I win. Like my team won, we win, right?
Wow, very
We play
cool.
to win. So that a challenge mostly is external, right? So, and I completely understand, right? If like I say a software engineer came to a hospital and said, "Hey, this is how you treat a patient," I'll tell them to go screw off,
Yeah,
right?
yeah, yeah, yeah.
So I need to like build, I sort of had to validate my technical skills, and I have done so based on the projects that we've done, the products that we built. So that was mostly not an internal challenge, because I like challenges. I like learning new things, because learning
Mm.
new things is always fun, as
Yeah,
opposed to just doing things that you previously learned.
right.
So my challenges were not necessarily internal; it was mostly external.
External. I just got done recording 2 days of my podcast, the Creative Odyssey podcast, here at Hatch.lk, one of the leading startup hubs in Sri Lanka. Because my goal was to be able to tell stories of unique creatives here who are crazy enough to think that they can actually solve problems. To be here at Hatch and be inspired in what I'm doing, and to be able to tell these stories and have this studio and opportunity, I'm super grateful to Hatch. I feel affirmed in my mission to highlight creatives, and when I saw individuals from startups like inviting their own friends to be on here so I can highlight their stories and their unique way of thinking, every single one of them has so much insight to provide to anybody who's watching, anybody who's thinking that they're not good enough to do what they're doing. Seeing stories from doctors who have changed careers into running startups, to journalists, to doing these kinds of things, like, it gives me so much hope to be able to share this to others, to say that, like, wherever you are at, if you're not passionate about what you're doing and you're stuck in your own bubble or whatever, find communities like Hatch, because it is going to be the best thing that you'll do for yourself, because the community is absolutely amazing. Hatch, thank you so much for the support you provided. I can't wait to show you the amazing stories and the insights your own people are going to share with the world. That's usually the other way around. A lot of people have imposter syndrome because of internal challenges, but you got that part down.
Yeah, I mean, all doctors, I would say, have a certain level of imposter syndrome. So you learn to deal with it,
Mm.
because you always think I'm not good enough, or maybe I can't handle it. But like in surgery, it's see one, do one, teach one. You
Mm.
see a surgery, like let's say a cesarean section, you do one, and then you teach the next guy. So that training sort of helped me address that. So I knew, all right, I have this. How do I deal with it? Go for competition.
Wow. So you already knew your skills, you already knew the mentality. So that was just easy for you to just jump in.
Yeah.
It was a lot of work. Was it like you had to prove yourself?
Yeah,
But
it's definitely a lot of work. I mean, since for the last 2 years, it's been a constant, headlong rush into this.
mm.
Like no vacations, none of that stuff. Rarely, I think last month I took the first vacation in a very long time. Uh, but like, because it's interesting for me, right? It's fun. So it's not. I don't necessarily think, oh damn, I need to do this today. But I say, oh damn, I get to do this today.
Right, you're passionate about
Yeah.
it. That's cool. I'm curious, how does your family respond to it now?
Well, my mother's kind of okay with it, I guess. I'm in Colombo,
Ah, okay.
so that's one thing. If I was practicing, I'll be, middle of nowhere.
Right.
I get at least my proper sleep. But they're excited about it, because AI is kind of new. They don't necessarily understand what it is I'm doing,
Right, right, right,
but it's
right.
something to do with AI.
That's very cool. Looking ahead, what impact are you trying to make with your company?
So with the startups that I'm involved in, with Vector, it's mostly about bringing Sri Lanka forward as well a bit, because Sri Lanka has traditionally been quite backwards when it comes to technology, right? But with generative AI, we are able to go toe to toe with the big guys, even in the United States, without like a massive budget, and we're able to give the same service, because where we don't just sell to Sri Lankan companies, we're global,
Right.
but we want to give the Sri Lankan companies an opportunity as well to upscale themselves, and to meet like a global level. In terms of my healthcare, the healthcare startup I'm involved in, it's public health, right? So which I'm very passionate about, especially in Southeast Asia. We have a large percentage of non-communicable diseases. Brown people have a lot of diabetes, hypertension, cholesterol,
Yes.
and AI agents are perfect for managing that through education, like your own personal doctor in your pocket, which you can talk to, and it will remind you like, hey, it's lunchtime, I know, but your blood sugar is a bit high last month, so make sure you don't eat. Or maybe you say, I don't want to do this. They can challenge you on certain beliefs,
Right.
because regardless of your educational status, people have very silly ideas about their health, like, oh, it's diabetes, or I'm feeling okay, so I don't have to take these medications all the time.
Right.
So then, like, what we do as doctors, we counsel them, but how much can you do? We can't talk to everyone, right?
That's true.
And that's where generative AI comes in.
That's true.
We're so excited to share with you all of the episodes that we filmed in Sri Lanka. We know a lot of you have been waiting, but we wanted to make sure that we did this really meaningfully because it really was an exciting time. When Sharon first came to me and said he was going to take the podcast to Sri Lanka, I honestly thought he was crazy.
And so did I. I was like, is there any possibility we can fit this in? I want to try to bring the podcast there and get to know people and interview creatives. So
we expected to have just a few conversations, maybe a little sparks of inspiration here and there, but what happened was so much deeper than that. We met so many people that not only you got to interview, but that also like came alongside us to help make these conversations happen.
The crazy thing was this daring idea of going to a country, even though I'm from Sri Lanka. I hadn't been back for like 7 years. And all I knew was some people from school that I went to and some on social media that I've been following, but didn't really have a concrete plan to make it happen. And some days we had 6-7 episodes back to back recorded because people were waiting and you were kind of facilitating that.
Yeah, so it felt really significant because not only was it that we were having like these raw and authentic conversations, but a lot of their stories resonated with Sharon's, and so it just was really fascinating to see them speaking the same language and to see like just this commonality of creativity and identity and purpose coming out as the themes of these conversations.
You must be wondering when this trip happened. It happened in September, and the goal was to get these episodes out by December or last year. Well, a lot of things happened, and I didn't want to diminish the work we put in, and again, the amazing guests that we've had. So we decided to do something really cool, and we're going to post however many we can a week.
So linked in every single episode, you'll find a free PDF. It's actually a magazine that we developed. You can kind of think of it like if you go to a concert and you get like the souvenir of what happened behind the scenes and just about the different artists and all those things. We wanted to share with you not only about Sharon's journey, but then help you connect with some of the guests that we interview in Sri Lanka, and then invite you on your own creative odyssey.
Yes, there's so much more that goes into or that fuels this podcast, which is this mission to inspire people to create so that they can get to know themselves and connect with their inner child. So to see that we could bring that story out of Sri Lankan creatives, a wide, diverse range of creatives, was definitely a highlight.
Our hope is that whether you're living in the States, you're living in Sri Lanka, or somewhere else around the world, you'll connect with someone's story within Sri Lanka, and it might inspire you to continue on your own creative odyssey.
The link to the PDF of the magazine is in the description, and please check it out. They're doing really cool things that I really think you should be checking out to see their journeys. So without further ado, let's get to the episode. So anybody looking into either making a change in careers or getting into the AI space and startup space, what advice do you have for them?
Do it now. It's never been easier to learn. I honestly wish I was in university when Claude and ChatGPT came out, because back in the day, if I didn't know something, it's not like these are like question answer type of things. These are scenarios. I had to flip through multiple books, multiple websites, and even then I'm confused. Now you can just ask it. Similarly, if you want to learn generative AI or anything, it's just so easy, it's so cheap. There's so many resources online to learn by yourself. And I do feel in the next few years, the value of a degree by itself is reducing.
I agree.
It's mostly about what you can do. And if you're passionate enough, if you have the drive, doesn't matter where you are. If you have like a phone or a laptop and some internet, the rest is on you.
You mentioned, Sri Lankans are behind on AI, and I think in certain aspects,
Sri Lankan companies, I would say.
Companies, sorry. So I was thinking, as far as changing the narrative, and even in US, there's certain people who are against AI, and like myself, I'm fully into it. I'm grateful for it because I can learn so much about whatever. How do you encourage people, especially people who are like talking always about the negative aspects of AI and everything, and how can we convince people to say it's here?
It's always good to have an opposing point of view.
Yeah.
Because generative AI, as great as it is, does have, it's everything has pros and cons,
Exactly.
right? I would always say, like especially in healthcare, it's only probably in the last few months it's becoming generally accepted that it could be used because large players are getting into it. So I would always say look at the benefits of it, because the benefits far outweigh the risks. But then again, there'll always be a lot of people that will be completely against it. I mean, I'm pretty sure when the motor vehicle was invented, there were people who were against the motor vehicle and said the horse is better. And those kinds of people, you can't necessarily change their mentality, and I don't necessarily bother, trying to convince them.
Right.
I always say find something that AI itself is a tool,
Yes.
but you need to use that tool on something. So you need to have domain expertise on something. It could be even farming, right?
Right.
So I just did a session on vibe coding on Lovable for a hackathon that's happening in Sabaragamu, right? So this is a bunch of school kids, 8 to 15 years old,
Wow.
relatively rural. It is online. I could not make it there, and there were 1,000 people in that call,
Wow.
right, on that Zoom call, and they were fully into it. And like one kid turned on his camera. He's like, "Hey, you just said no code, low code, but can I actually code?" They're like, "Yeah, sure, go for it."
Wow.
And like, how do you if you do it? Like I said, plenty of resources online. If you want a completely free, access to the latest sort of models of LLMs, Google AI Studio, completely free. You can even build stuff on Google AI Studio.
Right.
ChatGPT itself has a really good free tier. Claude itself has a good free tier. A lot of these things, even the coding agents themselves, GLM has a package for like $6 a month, which is pretty affordable, I would say.
Yeah.
The tools are freely available. You can literally start with $0.
So that mentality of like we don't have anything.
That's the only thing holding people back, I would say. I mean, if you have two hands, a laptop, I mean, it's not fair. Yes, some person might have more than you, but it is what it is. Either you can complain or you can, live with the cards that you're dealt.
Absolutely. Siddhartha, thank you so much for taking
No
the time. I'm super grateful for you. All I gotta say is keep dreaming, keep creating, and keep going on your own creative odyssey. Till next time, see you later.